हेलो हाय आदाब और सत श्री अकाल। एक बार आ गया हूँ फिर से आप लोगों के बीच, आपका हमरा आरजे अभिनव 90.4 मेगाहर्ट्ज कम्युनिटी रेडियो ज्ञानवाणी यानी कि ज्ञान की वाणी पर। आज स्कूल ऑफ मेडिसिन से एक और शख्सियत है मेरे साथ, क्योंकि अब ये जो शो का वक्त हो चला है, ये वक्त है नो योर डिपार्टमेंट का। इसमें हम हमेशा एक फैकल्टी के साथ आप लोगों के पास आते हैं, जिसमें उनके डिपार्टमेंट से जुड़ी हुई कुछ खास बातें हमें पता चलती हैं। जैसे कि अगर कोई नया रिसर्च है, कोई नया प्रोजेक्ट है, कोई नया कोर्स शुरू हुआ है, और इसके अलावा फैकल्टी ने भी कुछ अगर नया योगदान दिया, कोई नई रिसर्च की है, इनके बारे में पता चलता है। आज मेरे साथ हैं डॉक्टर ओम तावरी। वो सीनियर फैकल्टी हैं स्कूल ऑफ मेडिसिन के रेडियोलॉजी डिपार्टमेंट में। तो सबसे पहले सर का हम लोग स्वागत करते हैं, यहाँ पर वार्म वेलकम करते हैं, और उसके बाद सर से कुछ सवालात करेंगे, सर से पूछेंगे। लेकिन सबसे पहले उनका वार्म वेलकम। सर कैसे हैं आप? आपका बहुत बहुत वार्म वेलकम है, बहुत बहुत स्वागत है नो योर डिपार्टमेंट में। हाउ आर यू सर?
नमस्ते, मैं बहुत अच्छा हूँ, बहुत खुशी है मुझे यहाँ आकर। और आप बताइए क्या चाहते हैं आप मुझसे?
सर चाहते ये कि कुछ जो स्टूडेंट्स हैं, जैसे कि आप एजुकेट करते रहते हैं, टीच करते रहते हैं, रेडियो पर भी कुछ टीच करें, आपसे चंद सवालात करेंगे और आपसे जानेंगे कुछ चीज़ें रेडियोलॉजी के बारे में। तो पहला सवाल सर ये, व्हाट इज द हिस्ट्री ऑफ रेडियोलॉजी? प्लीज टेल अस अबाउट
रेडियोलॉजी डिपेंड, इट मीन्स द एक्सरे एब्सोल्युटली इन द लोकल टर्म। और हिस्ट्री ये है, सर विलियम रॉन्जन who discovered X-rays in 1895, to be precise 8 November. He detected the X-ray accidentally. His wife's first X-ray was taken, and that X-ray was done in 1895, almost 128 years now. And because of that, we all radiologists are, we can say he was the mentor, he was everything for us. So we salute Sir William Röntgen today, and we go ahead after this.
Oh, wonderful. What are the recent updates in radiology department?
In the radiology, when I remember 50 years back when I started my radiology, people used to call us photographer, just photographer. But over the period of 50 years, it has taken a U-turn, total U-turn. Today radiology is one of the, all over the world, #1 branch in the field of medicine. The best of the students are coming for this branch because of the development of radiology. First we started with the X-ray in our department. Like X-ray was started earlier. Now we have a system of digital radiography has come in a big way. And following that, the other modalities like ultrasound has become very, very vast, useful technology now. After that, CT scan came, then magnetic resonance imaging came, PET CT scan has come, combination has come, hybrid imaging has come. So, and therapeutic radiology has come in a big way, where radiologists are treating the patients like surgeons. So things have changed totally, U-turn has taken place, and that is the reason this is one of the best branches today. And luckily we have all these facilities in our department at this institute, D.Y. Patil Medical College Hospital.
Interestingly sir, nicely explained. लेकिन हालांकि ऐसा लगता नहीं कि 50 साल पहले पुरानी वाली बात होगी, क्योंकि सर को देखकर बिल्कुल नहीं लगता है कि सर 50 साल से ऊपर के भी होंगे। सर एक तीसरा और सवाल है, वो मैं जरूर आपसे पूछता हूँ। What are the academic and research activities in the department?
Yeah, this is the most important part of, this was the main reason, with the support of our chairman, I joined this institute, and insist my colleague Dr. Madan Mohan, who insisted that I join this institute. Because of this, we have got a wonderful team of academic teachers here in our institute, and the various programs which we conduct are excellent technology programs here. Most academic activities, our department offers a range of academic programs, including undergraduates, graduates, postgraduates, technical staff, and the program provides students with a solid foundation in our field, equipping with all the knowledge and skills needed to successful careers. We continuously review and update our curriculum for ensure that this is with the alignment with the latest technology, with the industry trade, and we are par with the international world.
Wonderful.
Then we have got the facilities like research initiative we are taking, we are involving our all students in the participation of the research, and there are research lab facilities are available. We encourage our students to do a lot of publications at the level of not only the national level, international level, so that they are exposed to different academic activities. Student research opportunities are given plenty here. This is what main area here. and we try to research collaborate with the national and international institute. Luckily, last year I visited University of Washington, Seattle, and I was wonderful to see those departments. And we are lucky they are ready to collaborate with us, our department of radiology. So this is what we are doing here. Seminars and workshops are done on a regular basis. The case-based studies are done very regular basis in the inter-department, intra-department, with the other state level departments and national level and international level. Lot of works are being done with us here. We had opportunity to start a big international meeting. We had Menspire 4 years back before COVID era, and it was one of the largest meeting in India where more than 15,000 delegates participated. And for us, radiologists, almost every meeting more than 500 participants were there. So similar programs we are going to have in future with the support of our chairperson.
मतलब इतनी सारी चीजें, इतने सारे कोर्सेज हैं, इतनी एक्टिविटी हो रही है, तो स्पेशली स्कूल ऑफ रेडियोलॉजी नाम रख देना चाहिए. मतलब सिर्फ एक डिपार्टमेंट में क्यों, मतलब इतनी ज्यादा तो एक्टिविटी हो रही होती है, इतने तो कोर्सेज हैं. तो मुझे स्पेशली अच्छा लगा आपकी बात सुनकर.
और एक मोर जो इम्पोर्टेंट जो कहना चाहता हूँ कि at the end of all this medical services research, what we are doing for community, और हमारा सबसे अच्छा ध्यान वही है. सो हमने बहुत रिसेंटली हमने मैमोग्राफी यूनिट डेवलप किया है यहाँ पर. हमने सीटी एंजियोग्राफी हो रही है हमारे यहाँ, जो कॉमन मैन के लिए वन ऑफ द लार्जेस्ट डेथ इन द वर्ल्ड इज टुडे इज द मोस्ट कॉमन कॉज ऑफ डेथ इज कोरोनरी आर्टरी डिजीज. और उसके लिए हमारे पास प्रोग्राम है सिटी एंजियोग्राफी. सो वी कैन डिटेक्ट, वी कैन प्रिवेंट, we can participate in the healthcare, and that is what is happening with us. And all the students are getting trained with this technology. Similarly, the breast cancer is one of the most common cause in our country. And very late detection is being done, and that's why the mortality is very high. Death rates are very high because of that. So we have got the facilities of mammography for early detection, and we have got a wonderful team of expert who are expert in the women's imaging here. We can help very, very nicely, and that is at large. We can help the entire community, starting from here, from New Bombay up to Pune. We can go ahead on this side of city up to Pune. People are coming to us from this technology, and most important is I am very happy myself, very happy as a radiologist, that this is one of the institute in Mumbai city which has got the highest technology and lowest rate, which is very good. And that was the reason probably for me to join this institute. I'm moving with the technology.
Oh, wonderful, wonderful. Great, sir. जो कि आपने स्पेशली एंड में बताया कि भाई बहुत कम रेट पर बहुत ज़्यादा हाईएस्ट टेक्नोलॉजी है जो यहाँ पर स्पेशली स्टूडेंट आकर जो सीख सकते हैं वो सीखते हैं. सर, हाउ इज द रेडियोलॉजी डिपार्टमेंट एट DY Patil सर्विंग द पीपल एट लार्ज? हालांकि आपने काफ़ी कुछ उसके बारे में बता दिया, जो मेंशन्ड अ लॉट ऑफ थिंग्स especially, but if you can add something.
See, it is so important. Today we are able to see at least more than 400 X-rays per day and about 40 to 50 CT scans per day, and we are providing 50 CT MRI and sonography more than 150 to 200. So at large, thousands of patients are coming to our department of radiology at all levels, standing from lowest to the richest man. They all come to our department, and same care is taken care for everybody. There is no shortage of care there. हम पूरी कोशिश करते हैं कि सबको एक जैसा देखें और सबको एक जैसा हम डायग्नोसिस में अपनी पूरी मेहनत करें. और यहाँ तक कि हम लोग 24/7 सर्विसेज ऑफर कर रहे हैं, इमरजेंसी सर्विसेज. हमारे कम से कम 50 डॉक्टर्स जो लगे हुए हैं, इंक्लूडिंग सीनियर फैकल्टीज, दे आर ऑल अवेलेबल राउंड द क्लॉक फॉर दिस फैसिलिटीज in a absolutely professional way, and with humble and with respect to the patient. हम यही समझते हैं कि ग्राहक हमारा भगवान है, और उसी कल्चर में हम जाते हैं और इसको मानते हैं.
क्लैपिंग फॉर यू सर, स्पेशली आपके लिए और उन सब डॉक्टर्स के लिए जो स्पेशली हेल्प कर रहे हैं, अच्छे से ट्रीट कर रहे हैं यहाँ पर जितने भी पेशेंट आ रहे हैं, और बिना किसी भेदभाव के, और पूरी कोशिश करते हैं अपनी तरफ से कि उनको जितना भी सपोर्ट दे पाएँ, अपनी तरफ से ट्रीटमेंट कर पाएँ, उतना ज़्यादा रहे. सर, एक और सवाल है, वो ये है कि हाउ डू यू टीच द स्टूडेंट्स इन डिपार्टमेंट? मतलब जिस तरह से आप यहाँ एक्सप्लेन कर रहे हैं बहुत अच्छा, और इससे कहीं ज़्यादा बेटर ही आप टीच कर रहे हैं.
हमारे यहाँ डिपार्टमेंट में वेरियस लेवल ऑफ फैकल्टीज हैं, एंड वी हैव गॉट अ रेसिडेंस सिस्टम फ्रॉम जूनियर अप टू द सीनियर मोस्ट पीपल coming to us, and we have got a technology which there are new technology also available. So we have different teachers of different Sub radiology is a base X-ray based. We have got one of the largest, Dr. Sopti is here, who's excellent in the radiology department. One of the well-known in the field of only radiology. Today, radiology teachers are not available in this city of Mumbai, and we are lucky to have a teacher like him, and including many other teachers they teach. Similarly, ultrasound department, we have got the best of the teachers, led by Dr. Madan Manmohan, who is well known in the city of Mumbai. And similarly, CT and MRI, we have got other experts, consultants who are doing good job. And along with me, as a senior mass, my personal interest has been a cardiac imaging. I had an opportunity to start first MRI in India, first cardiac MRI in India. So these benefits go to my students. I am lucky to have these students. I still feel the best teacher of our students only, because we share our experience, and in the era of 21st century, it is not easy for professors like us to maintain the same level of knowledge with every field. So my teachers are best, my students, मेरे विद्यार्थी मेरे टीचर्स हैं, और उनके इंटरेक्शन करके हम लोग आगे बढ़ रहे हैं, और हर फॉर्मेट में हमको उनको सिखा रहे हैं.
Keep updating and upgrading yourself.
Updating subjects, technology.
जब आज सर ने डॉक्टर मदन मनमोहन जी के बारे में बात की, तो स्पेशली उनसे हमारी कल मुलाकात होगी. कल सर का पूरा एक इंटरव्यू रहेगा नो योर फैकल्टी में, तो काफ़ी ज़्यादा बातें उनके बारे में हम लोग जानेंगे. उनकी पढ़ाई लिखाई से और टीचिंग से इतर वो खुद कैसी पर्सनैलिटी है, इसके बारे में ज़रूर जानेंगे. सर, और कुछ और सवाल है मेरे. व्हाट इज इंटरवेंशनल रेडियोलॉजी, प्लीज टेल अस अबाउट दैट.
यही नहीं, ये इंटरवेंशनल रेडियोलॉजी इज थेरापेटिक रेडियोलॉजी, मीन्स रेडियोलॉजिस्ट who are doing only diagnosis started treatment today, and because of that treatment we are able to help those patients who are acute bleeding और प्रोसीजर जहाँ अपसेस बन जाते हैं या पस फॉर्मेशन होता है एब्डोमेन में, आज रेडियोलॉजिस्ट इमेज गाइडेड प्रोसीजर से उसको ट्रीट कर सकते हैं, उसको एस्पिरेट कर सकते हैं अपसेस को. ऑल दिस थिंग्स आर हैपनिंग. सम ऑफ द एन्यूरिज्म इन द ब्रेन दे कैन बी ट्रीटेड विथ ओनली इंटरवेंशनल रेडियोलॉजी. Incidentally, my son has to be interventional radiology, who is in Portland. Portland has gone from India. So we are also extending with all the interventional radiology, all these facilities to treat those patients and updating our department. We are lucky to have this department at our institute, where we are doing a lot of interventional procedures in this department. So this is a therapeutic radiology, and this is a future of radiology. So everybody, I encourage all the students to try to become interventional radiologists.
Greatly explained, sir. What is the role of artificial intelligence in radiology? Especially, I wanted to ask you that with the emergence and the boom of artificial intelligence, so any effect actually, or it will affect the era or area of radiology, or especially in the school of medicine, or especially the field of medicine. What do you say? What's your take on that?
With the advent of technology, we are not left alone. So artificial intelligence is affecting the radiology in a big way, because it is purely the machine learning parts here, and most of the diseases today, which are very small nodules, which are overlooked by our visual eyes, are being picked up by AI, artificial intelligence, and it is going to take a big way. My appeal to all my colleagues, all my students, that they have to know artificial intelligence in a big way, because that will become the future of, not only future of the other branches, but future of radiology. So their knowledge with the machine learning is very important. And most important, we have to reach to the smaller area, peripheral area, village area. If you understand this technology, we'll be able to help them in a big way. Recently, I happened to be visiting the Department of University of Washington. They already started in a big way the program. So we had started this program of AI in our hospital, MedSpire, when we had invited the international faculties to, and we are looking forward for this department to come to our hospital, because our university is associated with the biomedical engineering and medical field. So it is very easy for us to start a department of artificial intelligence and use our engineers and scientists for this purpose to be utilized for AI. So we are lucky to have this department here at this hall, lucky to have engineering college nearby. So we can future start the department of artificial intelligence and biochemistry combined together. It will be wonderful.
Wonderful. So any pros or cons especially with this? That by chance of artificial intelligence.
This is
But you
see,
see,
there is a fear among them whether people will be jobless or
job
this is
reduction or
this is
something
just
like
a fear. We cannot get away. Every technology has got its side effect also. We have to understand, use the technology with the knowledge. That's why it is important for my radiologist colleagues and students to understand that machine learning is most important. If they know the machine, they'll be always one up ahead in this field. And it is very important to help other colleagues, other department like medical department, surgical department. If your knowledge is very good with the subjects, if your knowledge is not good, then you're going to have problems with those, because you cannot avoid AI, because it is coming to every field of life.
definitely.
So yeah,
They're capturing the field.
capturing the
Basically.
field all over the world, it is happening. And we Indians are good in mathematics. It is all proved, all beyond doubt. All over the world, people know Indians are excellent in mathematics. So with this background, we can do wonderful jobs in AI field.
So in the next 5 or 10 years, where you are seeing the radiology department, I mean, it is booming or it is developing more and more.
Radiology has to go. It's a vertical growth. Radiology. There are a lot of research are going on. एक जमाने में हम सोचते थे कि ये डाकू है, ये गुंडा है, ये this study can be done with MRI today. You can find out what chemical analysis is taking place in the brain. So today, with the advance of MRI happening, functional imaging has become a big part. You can determine that the people who have got suicidal tendencies, who are schizophrenic, all this can there has to be something there, and lot of research works are going on. So future of radiology is excellent, brilliant, and vertical growth. It has no way to look back. And with the therapeutic radiology and the heart imaging, we are trying to attack with the CT and MRI combination. It will replace catheterization. I see not very near future. It will be one-stop shop. Cardiac imaging will become one-stop shop to do all heart imaging. It will bound to happen. This is the future of radiology.
Oh, wonderful. Thank you, sir. Thank you so much. Greatly explained actually everything. सर ने काफ़ी सारे सवालों के जवाब दिए और हम लोगों को काफ़ी ज़्यादा बेहतर तरीके से बताया रेडियोलॉजी के बारे में, स्पेशली काफ़ी ज़्यादा चीज़ें जानने को मिली. कल दोबारा मेरी मुलाकात होने वाली है स्कूल ऑफ मेडिसिन से ही डॉक्टर मनमोहन, जितना मेरे को बिल्कुल अच्छी तरह से अब सर का नाम याद है स्पेशली. तो आज डॉक्टर ओम तावरी सर से हम लोगों की मुलाकात हुई और इसके बाद स्पेशली स्कूल ऑफ मेडिसिन से कल दोबारा वो फैकल्टी आने वाले हैं, उनसे हम नए फैकल्टी में मुलाकात करेंगे. आप लोगों के साथ बने रहेंगे यहीं पर 90.4 मेगाहर्ट्ज कम्युनिटी रेडियो ज्ञानवाणी. थैंक यू सो मच. थैंक यू सो मच सर.
थैंक यू. धन्यवाद. प्रणाम.